Joining us now is Dr. Anthony Fauci, the nation's top infectious disease doctor, chief medical advisor to President Biden, and the director of the National Institute of Allergy and Infectious Diseases at the NIH. Dr. Fauci, I know you are one of the busiest scientists in the country right now. It is an honor to have some of your time to help us understand what is going on. I know a lot of people have a lot of questions, so we appreciate your time, sir. And there has been plenty of criticism of this new CDC guidance from some public health experts, specifically because of the lack of testing requirements to come out of it. And putting that aside there for a moment, there's also been a lot of criticism from members of the general public. I'm sure you're aware of that. People who have been following federal public health guidance closely for the past 2 years in order to stay safe and healthy. People who specifically have come to trust you most of all. And some of them are responding to this lightened guidance on isolation with confusion, certainly some nervousness and some new distrust. What would you say to them this evening, sir?
Well, I would try to explain, which we've been trying to do most of the day, of why the CDC made that decision. It is very clear right now that when you look at the original guidelines for people who get infected, you put them into isolation for 14 days. Many people with this new Omicron variant get asymptomatic infections. And as you just showed, multiple examples of the rather severe disruption of society from people who are out of work because, in fact, they are infected. So they were trying to strike a balance. How do we do good public health principles at the time we don't have to get to the point where you're forced to essentially shut the country down? And the decision was made that for people who are asymptomatic, that they should go into isolation for 5 days. And if they remain asymptomatic, they can then go back to their function, provided they consistently wear a mask. And when they said part of that was the thing that I think has caused the controversy, is that the CDC said that at that point you don't need to do an antigen test, and people question why. And the reason is that if you look at the risk of transmitting infection from a person who is infected during the first 5 days of that period versus the second 5 days, most of the risk is segregated in those first 5 days. And so the risk is very, very low of transmitting as you get into days 6, 7, 8, 9, and 10. And the tests that are used, the antigen test, don't really have a good predictive value as to whether or not you're transmitting. They have a good value early on to say if you're infected. But as saying 5, 6, 7, 8, 9 days later, whether it's positive or negative, it's not a good, because we don't know any studies at all that have shown. And in fact, the original FDA approval of the test was not for the purpose of determining if multiple days following infection that you are able to transmit. And for that reason, the CDC said it was not necessary to have a test because the risk is low. So that's the explanation for that policy.
So allow me just to button this up for a moment, because last Thursday, the CDC released new guidelines for healthcare workers who get COVID, and they have to isolate for 7 days, and then they have a negative rapid test before they can leave isolation. And I think that begs the question, why? Why 7 days for healthcare workers and 5 for the rest of us? Why do they test out of isolation while the rest of us do not? You touched upon that specifically, but is this based on specific scientific data? Is this data published, or is it internal to the CDC?
It's internal to the CDC. There's no specific data one for the other. They made a judgment call on that, and it likely, if you look at the guidelines, that it can go back to 5 days for the healthcare workers too, if they really need that.
If you have been exposed to the coronavirus and need to quarantine, there is a different guidance for people who are vaccinated and boosted than for the unvaccinated. But if you're infected and need to isolate, the recommendations don't change depending on whether you are vaccinated or not. Can you explain that for us?
Yeah. If you're infected, you're infected. Whether or not you're vaccinated or not vaccinated, you're infected. When you talk about exposure and quarantine, if you are a person who is vaccinated but not boosted versus a person who is not vaccinated, because of the greater degree of protection that you would have gotten from being boosted, they're treating people who are vaccinated but not boosted as the same risk of those who are not vaccinated at all. And that's because that right now with Omicron, there's a great deal of difference in the level of protection that you get from being boosted following vaccination versus following vaccination alone.
I want to ask about being contagious and transmissibility for a moment. You explained that the reason we do not need to test a requirement after a positive person isolates for 5 days is because the science says the odds of being contagious after those 5 days are low. Dr. Walensky has given a few additional reasons. She said a couple times today that a PCR test could give someone who had a COVID positive result for up to 12 weeks. So is a PCR test not a good barometer either for transmissibility and isolation length? I mean, how can people actually tell if they are contagious in the cycle of having COVID? How do you measure that, if not with either a PCR test or an antigen test?
Yeah, that is a very good question, because a PCR doesn't measure replication competent virus. It measures viral particles, nucleic acid. So in other words, I could be infected, have cleared the replication competent virus from me, but I can continue to be positive with a PCR for several days after recovering and not being transmissible at all. So although a PCR is good to tell you am I infected? Yes, I am infected. But the very fact that it's positive for, as the CDC director said, for several days and even weeks later, it doesn't give you any indication of whether or not you're transmissible. And I think that's the understandable confusion that people have about testing. Testing saying whether you're infected or not versus are you infected plus transmissible. The only way you could tell if it's transmissible, if you can show that there really is live replication virus in you. And the tests don't measure that. They measure the presence or absence of the virus.
Right.
And the virus could be dead, inactive virus that doesn't transmit. So it's entirely understandable why people can get confused over that. And that's the reason why I'm here trying to explain it to people to hopefully clarify that.